What if everything you thought you knew about heart disease missed the real culprit? In this video, we explore the controversial question, can a ketogenic diet improve heart health, even in type 1 diabetes? We'll dive into a compelling case study that challenges mainstream views, where high LDL levels collide with perfect glucose control. Is it time to rethink the real risk factor? Insulin, not cholesterol? Let's find out.
Okay, let's jump right in. Today, we're taking a deep dive into understanding cardiovascular disease risk, but with a very specific focus, the role of glucose.
Yeah, and we've got some really interesting source material here, a unique long-term case report, some related research discussions. It's quite a stack.
Right, so our mission today is really to unpack these sources, to try and figure out what they're suggesting about the main drivers of heart risk, especially when we talk about metabolic conditions like diabetes.
Exactly. And, what happens when a particular diet comes into play? One that, well, it often stirs up a lot of debate.
Especially when used long-term in a high-risk situation. Because there's a finding in here that kind of challenges the usual thinking, isn't there?
There really is. We're talking about a case where, things like LDL cholesterol, the bad cholesterol, were actually elevated.
The sort of thing that usually sets off alarm bells.
Right. But despite that, other outcomes, specifically heart and blood vessel health, looked, well, remarkably good over a whole decade.
And the material seems to point towards why that might have happened.
So let's maybe set the stage first. Let's talk about the specific group that features heavily in these sources, patients with type 1 diabetes, T1D.
Yeah, and the risk profile for them it's stark. The sources mention a tenfold higher risk of cardiovascular disease compared to people without T1D.
10 times. And sadly, for most people with T1D, cardiovascular events are the leading cause of death.
So the big question, based on the research you shared, is what's actually driving that huge increase in risk?
Well, the evidence presented here points overwhelmingly toward elevated and fluctuating blood glucose levels, and also insulin resistance playing a role.
And this link between glucose and heart problems isn't just a theory, is it? The sources really lean on some major studies, like the DCCT trial.
Oh yeah, the DCCT, that was a landmark trial. Huge. Funded by NIH, ran for over 30 years, cost hundreds of millions.
Involved over 1,000 patients, I think. What was the key takeaway regarding glucose from that one?
It established a really clear causal link. Better glucose control directly led to major cardiovascular benefits for people with T1D.
Okay, but how did they achieve that control?
They used intensive insulin therapy. And here's the really interesting bit. That approach actually caused patients to gain weight.
So they gained weight, which we usually think of as a negative for heart health.
Exactly. But despite that weight gain, the improvements in glucose control alone accounted for, get this, 99% of the cardiovascular benefits they saw.
Wow, 99%. Just from managing glucose better, even with higher insulin and weight gain, that really does make a strong case for glucose being absolutely central here.
It really highlights its importance, doesn't it? And, while DCCT was focused on type 1, the sources do point out that the underlying issues like problems regulating glucose or dysglycemia and insulin resistance are quite similar in type 2 diabetes as well.
So the idea that glucose is a primary driver probably applies more broadly.
It seems likely, yeah. The mechanisms share a lot of overlap.
Okay, so this is where one of the papers you pulled gets really interesting. It was published in Diabetes Care, the ADA's journal, and it actually tried to rank the different cardiovascular risk factors for people with T1D.
Yeah, they did a hierarchical analysis, looked at all the usual suspects, age, blood pressure, lipids, smoking, etc., and tried to see which ones had the biggest impact on risk prediction in this specific population.
And what came out on top? What was number one?
HbA1c.
HbA1c, that's the measure of average blood sugar over, 2 or 3 months?
That's the one. It reflects your chronic glucose exposure. And according to this analysis, it was the single most important predictor of cardiovascular disease risk in T1D.
Number one, ahead of things like your age or blood pressure. Even triglycerides, which I think the sources said were also ranked pretty high.
Yep. HbA1c was number one. Age, blood pressure, triglycerides were up there too, but HbA1c was top.
So where did LDL cholesterol land? The one we hear so much about.
That's the surprising part for many people. In this T1D specific analysis, LDL was ranked significantly lower. It came in at number 10 on that list.
Number 10. Wow. So based on this research, it really looks like glucose levels are the main engine driving cardiovascular risk, particularly in diseases like diabetes where blood sugar is out of whack.
It strongly suggests that yes, it doesn't mean LDL is irrelevant, of course, but its relative importance in this context compared to glucose appears much lower based on this ranking.
Which logically brings us to thinking about things that can massively impact glucose levels, like the ketogenic diet, which features heavily in the source material.
Right, the ketogenic diet or keto.
Can you just give a quick, simple definition for anyone listening who might not be totally up to speed?
Sure. At its core, it's an eating pattern that's extremely low in carbohydrates. So by cutting carbs way down, you dramatically reduce the amount of glucose coming into your system from food.
Which means lower blood sugar levels overall.
Much lower blood sugar levels, yeah. And consequently, a significantly reduced need for insulin, whether that's insulin your body makes or insulin you inject.
So if glucose is the #1 risk factor, like that hierarchy suggests, then a diet that can potentially normalize glucose.
Well, it seems like a very logical thing to investigate for diabetes, right?
Absolutely. And the sources do mention some earlier work. Observational studies, like one from Belinda Leonard's involving patients from Boston Children's and Harvard.
What did that study look at?
They looked at a group of people with type 1 diabetes who were already on their own following very low carbohydrate diets.
And what did they find in terms of glucose control in that group?
They found this group achieved an average HbA1c of just 5.67%.
5.67%. Why is that number so noteworthy for someone with T1D?
Because the typical average HbA1c for T1D patients is often above 8%, sometimes well above. An A1c of 5.67% is essentially in the normal non-diabetic range. It showed the diet's potential to really move the needle on that #1 risk factor. Okay, but here comes the rub, right?
Yeah.
The controversy that the sources definitely acknowledge.
Yes. The ketogenic diet is usually high in fat, and often that includes saturated fat.
And saturated fat has a well-known effect on certain lipids.
It does. It's known to often raise LDL cholesterol and also another related marker called ApoB.
ApoB, that's a protein component of LDL particles, also linked to risk.
Correct. So you've got this tension, a diet that might be amazing for fixing the #1 risk factor, glucose, but it also tends to raise these other markers, LDL and ApoB, which are conventionally seen as bad for heart health.
So what gives? What happens when you have both those things going on for a long time?
And that is exactly what the central piece of this deep dive explores, that 10-year case report.
Right. Tell us about this study. It sounds pretty unique.
It really is. It's highlighted in the sources as the longest ever medically verified case report looking at a ketogenic diet in someone with type 1 diabetes who already had advanced cardiovascular disease risk factors.
And medically verified is key here, isn't it?
Yeah.
This wasn't just someone saying they ate keto for 10 years.
Absolutely not. The sources stress the rigor. Documented dietary compliance, confirmed ketone levels showing they were actually in ketosis, and really comprehensive medical testing before they started and then tracked throughout the decade.
What kind of testing are we talking about?
Everything. Detailed glycemic control metrics, insulin doses, body composition scans like DEXA, advanced lipid panels, and crucially sophisticated cardiovascular assessments, including a coronary artery calcium score.
Okay, so the big reveal. After a decade on this verified ketogenic diet, what did all that testing show? Let's start with glucose control, the #1 factor.
Over the entire 10 years, this patient maintained an average HbA1c of 5.5%.
5.5% average. That's truly normal glycemia, isn't it?
Yeah.
Like someone without diabetes.
It is. It's a level achieved by maybe only 1% of the entire T1D population. So exceptional control of that primary driver we talked about.
Okay, now what about the lipids, the LDL and ApoB that often go up on keto?
Just as you'd expect, the sources confirm that, yes, their LDL and ApoB levels were elevated. They were above the standard recommended targets confirmed with advanced testing.
So the potential downside did manifest in the lipid profile. You had the great glucose control and the elevated LDL ApoB. What did the actual cardiovascular tests show then? The functional ones.
This is the core finding. Despite those elevated lipid markers, the advanced cardiovascular assessments showed, well, exceptional cardiovascular health and physiology.
Better than expected.
Much better. Measures were significantly better than other T1D patients matched for age and sex. And remarkably, in many aspects, their cardiovascular function was even better than control groups of people without diabetes.
Wow. And the calcium score, that's kind of the gold standard for seeing if plaque is already built up, right?
Right. It measures calcified, hardened plaque in the coronary arteries. And the patient's calcium score was 0.
0, meaning no detectable established plaque after 10 years, even with the risk factors and the elevated LDL.
Exactly. A score of 0 is the best possible result. indicating no significant atherosclerosis visible by that measure.
The sources also mention these advanced measures of vascular hemodynamics.
Right.
What does that involve? It sounds like more than just the calcium score.
It is. Think of it like assessing how blood actually moves through the vessels and how healthy and flexible those vessels are. You see, high and variable glucose, like in poorly controlled diabetes, damages the vessel walls over time.
Makes them stiffer.
Precisely. The flexible, smooth muscle can get replaced by stiffer stuff, like collagen. The stiffening isn't good. It changes how blood flows.
Like pinching a garden hose, the water speeds up, pressure increases.
That's a great analogy. Stiff arteries lead to faster blood flow velocity and higher pressures, which puts more strain on the heart and vessels. These hemodynamic tests measure things like how well the vessels expand and contract, how pressure waves travel. They give you a window into the early stages of vascular dysfunction, even before significant plaque forms.
And the results on those tests were also good in this case.
Excellent, according to the report. They showed healthy vascular function, good elasticity, and normal hemodynamics. All this alongside the zero calcium score, despite the LDL and ApoB levels being high.
So this one case, albeit just one person, provides this decade-long picture suggesting what? That maybe if you fix the biggest problem, the glucose, the other stuff like LDL becomes less of an issue.
It strongly suggests that in this specific context, normalizing the primary risk factor had a profoundly protective effect that seemed to outweigh the theoretical risk from the elevated LDL over that 10-year period. It really forces you to consider that hierarchy of risk factors we talked about. Context matters.
Okay, so let's dig into why this might be happening. Are there mechanisms proposed beyond just lower glucose is good?
Well, the sources do touch on a few possibilities. One interesting idea involves something called the NLRP3 inflammasome.
The NLRP3, what now?
Inflammasome. It's basically a protein complex inside your cells that triggers inflammation, and it's been strongly linked to cardiovascular disease progression, especially in the context of diabetes.
And diabetes itself is inflammatory, right? High glucose fuels inflammation.
It does. Diabetes involves chronic inflammation and oxidative stress, and high or swinging glucose levels are known to directly provoke that. So one theory is that ketogenic diets might help suppress this NLRP3 inflammasome activity, reducing inflammation through that pathway.
So maybe an anti-inflammatory effect beyond just the glucose lowering.
Potentially. There's also some research suggesting the ketone bodies themselves, like beta-hydroxybutyrate, might have direct beneficial effects on the blood vessel lining.
Interesting possibilities.
Yeah.
But the sources seem to keep coming back to glucose as the main player.
They really do. While these other mechanisms are fascinating and might contribute, the weight of the evidence presented from things like the DCCT results and that risk factor ranking keeps pointing to glucose control as the dominant factor. The diet's primary power, based on this material, seems to stem from its unmatched ability to normalize glucose in this situation.
There was also that interesting point about saturated fat and glucose maybe interacting.
Yes, the speculation presented is that maybe saturated fat-raising LDL is much more problematic when it happens in an environment of high and unstable glucose.
But if you fix the glucose environment first,
Then maybe the elevated LDL from saturated fat doesn't have the same negative impact. It's a hypothesis based on observation, suggesting the background metabolic state really matters.
which brings us back to looking at the whole picture for health, doesn't it? Not just zeroing in on one lab value.
Absolutely. And that's a key message for you, the listener, from this material. It underscores the importance of a holistic view. Prioritizing health interventions based on what's likely to have the biggest impact, especially considering your specific situation, like having diabetes.
So don't get tunnel vision on, say, just your LDL number. If maybe your blood sugar control, which evidence suggests is higher up the risk ladder, especially with dysglycemia, isn't where it needs to be.
It's like that analogy of fixing a car, right? If the engine's shot, you don't spend all your energy polishing the chrome.
You fix the engine first.
You fix the engine. And in this context, the data presented strongly suggests that for cardiovascular risk in diabetes, glucose control is the engine.
Now, applying this kind of thinking can run into some real-world hurdles in healthcare, can it? The sources mention guidelines and maybe clinician knowledge not always keeping pace.
That's a really important point they raise. Emerging evidence, especially around nutrition, can sometimes take a long time to filter into standard medical guidelines and everyday clinical practice.
So a doctor, trying their best, might understandably focus heavily on lowering that LDL number because that's what current guidelines emphasize.
while maybe not fully appreciating the massive win that achieving normal blood sugar represents, especially if it was achieved through a method like keto that also raised the LDL, it creates a tricky situation.
And the sources highlight a specific gap. There aren't really standard clinical guidelines for doctors on how to use therapeutic carbohydrate restriction, like keto, safely and effectively for T1D patients.
There aren't. Even though more and more patients are trying it, it's led to groups like the Institute of Personalized Therapeutic Nutrition forming, doctors, patients, researchers coming together to essentially create the guidance that's missing out of necessity.
It shows a systemic challenge, really. Not a criticism of individual doctors, but how the system adapts to new information.
Exactly. It takes time for research to translate into widespread practice changes.
And finally, there's a point made that I think is really crucial about the patient's own experience. The sources say, how you feel absolutely counts.
Yes, this isn't just about feeling vaguely good. High and wildly fluctuating glucose levels cause real acute symptoms. Fatigue, brain fog, anxiety, depression, impacts on physical performance.
Things that seriously affect your day-to-day quality of life. And these can happen even if your glucose is technically within the standard target ranges, which are often still quite far from actual normal physiology.
Right. So when someone achieves truly normal glucose control, like in that case study, the improvement in daily well-being, energy, mental clarity, that's a huge part of the health picture that lab tests alone just don't capture.
Okay, so wrapping up this deep dive, the core message from these sources seems pretty clear.
It seems to be that while LDL cholesterol is certainly a factor to watch, particularly in the general population, the data, especially when you look closely at diseases like diabetes, where glucose regulation is the central problem.
It overwhelmingly points to glucose control as being the most critical factor for cardiovascular health in that context, the #1 driver.
And this unique 10-year case study provides some compelling real-world long-term evidence. It shows that getting glucose truly normalized, in this case using a ketogenic diet, resulted in outstanding cardiovascular health over a decade.
Even though the LDL cholesterol was higher than typically recommended, it really supports that idea of tackling the primary risk factor first and understanding the hierarchy.
Which leaves us with a final thought for you, the listener, to mull over. Science is always evolving, right? Our understanding of complex diseases, of diet, it changes, and clinical guidelines often lag behind that cutting edge.
So knowing this, knowing about this hierarchy of risk and seeing how diet might impact those primary drivers, how does that influence the way you think about your own health risks? How do you make informed choices when you might be getting different, maybe even conflicting messages about what matters most?